particular one, so forgive me. So yeah, good afternoon. Thank you so much for having us today. Really appreciate your time. My name's Peter Varey. I'm a Health and Wellbeing Lead in the Northwest team for Public Health England. My colleague Annie Murray joins us today as well. Annie will be focusing on aspects around mental health in the workplace, and I'll be giving a broader overview around work and health, which is my area within our team. I'm going to start with just check you can still see the slides. Okay, yeah.
Yeah.
Good, thank you. I'm going to start with a graph, which isn't necessarily the most exciting way to start a presentation, but trust me, it's worth understanding it. So people in public health, this graph comes from a particular document, a real seminal piece of work by a chap called Sir Michael Marmot, who wrote a paper back in 2010, which has recently been updated. Actually, a 10-year review took place last year, which essentially sets out some real disparities in health inequalities across the country, and I'm actually not going to use that to really discuss health inequalities in this particular context, but I will explain what this is about because it's quite useful and interesting to see. So if you essentially lined up everybody in the country, on the left-hand side, you put the poorest person in the country, on the right-hand side, you put the richest person in the country, and everybody in between. And you plotted this top line here, which is the one with the very lighter green speckles and a line of best fit through it. That shows you the life expectancy of everyone in the country, and you can see that there's a huge disparity there. You know, there's a 9-year gap in life expectancy. You know, but simply being poor is very bad for your health, and that really is the stark picture of what health inequalities really are. The second line towards the bottom with the darker dotted green dots and the line through it is what we call disability-free life expectancy. So what that means is it's the age that you get to when you acquire a long-term condition. So you may have chronic heart disease, diabetes, respiratory condition. So again, massive disparity, 17 years difference. So if you are the poorest person in this country, not only are you going to get a condition longer, you're going to be living and working with that condition longer, and sadly, you're going to die 9 years earlier. And yeah, I guess that's as I said, the stark truth of health inequalities. This green, but what the point I wanted to get to here is this green band across the middle here is our pension age, and then obviously it's due to shifts. So that's the line as it grows over the next 20 years or so. But actually, what this really shows to us all that really somewhere between 70 and 90% of all of us are going to be working and living with a long-term condition before we retire. So I guess as us as public health experts, one of our key focuses is to be able to lift both of those lines and straighten those lines as best we can. And I believe there's actually a duty in a sense as well for employers and employees to work towards that too, because we want to be enjoying those sort of later years in life, not be carrying.
I do.
Carrying long-term conditions through with horrible backache and all sorts of other horrible conditions with us. Yeah. So prevention is so important for us to be able to do that, and I think we all have a responsibility, I guess, to work towards that. So that's why I wanted to set that slide out at the beginning. And yeah, if you look at how the money breaks down, I mean, healthcare itself probably only contributes to about 10% of the prevention of premature deaths. Well, actually, the changes in those behavioural patterns that we have is estimated to contribute somewhere closer to 40%. But yet we only spend such a small 4% of our budget on prevention. And there's the obvious messages that someone like me would trail out at the moment. Sorry, excuse me. Oh. Sorry, there's a bee trying to get into my window. Sorry. There's the obvious messages we would trail out around, you know, giving up smoking, reducing alcohol consumption, and sedentary behaviour has such a massive impact. It's you know, I think someone said to me, sitting is the new smoking. It has such a fundamental effect on our life expectancy. I believe globally, I think it's the fourth highest cause of mortality is inactivity, funnily enough, and some of those ones above that are as a result of being sedentary, or one of the causes of being sedentary. So yeah, that is why it's important for us, really. And employment plays such a massive part in that as well for us. You know, there's a virtuous circle around productivity and health. Health is, you know, health is good for our productivity, and our productivity is frankly good for our health. It's good for your health to be in work, and it's obviously good for the workplace. It's good for the economy, and such an important cycle. I think there's a statistic out there that suggests that if you're unemployed for 6 months or longer, you're twice as likely to be dead within a year than someone that's working, which is a frightening thing to think about. So yeah, it's so important for us and the whole of the economy around us as well. We know as well that actually getting people back into work is such a huge benefit to the wider world, to our local authorities, to our NHS, to our government, and to our organisations as well. We believe that moving people back into employment saves around £12,000 per year, per person over a year. And the costs of people being out of work or on long-term sick accounts for something around 100 billion annually. In terms of the scale of the issues around illness at the moment, huge. I'm not going to read all those. Like huge numbers of days lost, really, around some of the more common reasons that we're going to be off work. And quite surprisingly, at least to me anyway, that only one in three people haven't even discussed some of those issues with their employers. So your employers are not aware to be able to help and support people through those conditions that they're living with. A bit more of a focus, I guess, down onto Lancashire, and I should say that we've created these slides as a resource for you to take away and look at in a bit more detail. Conscious there's a lot of information there, and I'm not going to go into great details, but please do feel free to flick through those and get back in touch with us. In terms of Lancashire, I must admit these are pre-COVID figures. We're still waiting to hear the impact, I guess, once all the support mechanisms are lifted from the government. Lancashire's in a fairly healthy state around employment and has relatively low economic inactivity compared to the northwest and to England. We know as well that before the pandemic, job seekers allowance claimants were significantly lower as well, but we are obviously likely to see quite a rise in that in the next 12 months. Musculoskeletal conditions are a little bit higher, I think, in Lancashire as well. So it's interesting to see that slight difference there, I guess, in our workforce too. Now, I wanted to spend a bit of time looking at a few different models, if I could, about what is good work and why that's important. And there's a few different ones I'm going to flip through very quickly. First of all is Dame Clara Black, who's done some great work researching health and wellbeing in the workplace, and lots of different pieces for the government on this. And I went to see her talk in Leeds a couple of years ago, and she sets out some core principles, really, that first of all, work to get the best out of work for people and for them to feel happy and comfortable in their workplace. It must be a stable and safe work, so that they're not on 0 hours contracts, or they're not worrying whether the contract's going to be renewed. That they feel safe and secure. That is when they're at their best and functioning their best. They have part of the control of the decision making within the organisation. There is a fair and equitable demand on the workload, the quality and quantity of that work. They're fairly paid for the work that they do as well, and that when they're off sick, that the organisations do help them come back into work as smoothly as possible. That there are flexible working arrangements, which I'm sure we've all experienced over the last 18 months. And there's the opportunity to become more, to do more, to develop, to grow. That we care about the health and well-being of our staff, and ways that we can help to prevent isolation, discrimination and violence in the workplace too. We did a bit of work recently. This is a Public Health England infographic we did around health and work. And when we really drilled into the core of what's important around looking after your workforce, it was that I think the primary thing is really to ensure that there is somebody at a strategic senior level that has a direct responsibility for health in the workplace, and that this is communicated to staff, and that they're aware who the lead is and what their plans are to ensure and maintain the well-being of their staff. To encourage healthy behaviours such as physical activity, commuting to work, maybe actively if you could, taking regular breaks, eating well, looking at taking up any of the sort of larger scale programs that are offered, such as Stop Smoking or the cardiovascular NHS health check, access to occupational health and services and physiotherapy, good training for managers to help them to be able to support people as well, because often we find managers find it difficult talking about particular illnesses and situations that they might find uncomfortable. That we've got that flexible working in place, and we have an understanding around sickness absence, so that we can really get a feel as organisations for what are the core issues, and to carry out a workplace health and needs assessment, which is something I'll come on to briefly a little later on. This is another model which really just, again, you can go and look at in your own spec. This is a fantastic resource here that Annie's put on here for us. It's a great way to just to slice up some of the important aspects of well-being in the workplace, around your health, security, the environment, the relationships you have with people and line managers, and that purpose, like we discussed earlier, about the engagement and the quality of your work. And finally, the Greater Manchester Good Employment Charter, we thought was a really good one to have a look at too. Again, there's a link at the bottom here. Along similar lines to Dame Carol Black, ensuring secure and flexible work, they're paid a real living wage, they have that voice and that engagement, that recruitment is fair and open and is accessible for all, people are managed fairly, and health and well-being is central to how you look after your staff. So that was a very, very quick whistle-stop tour through some of the best advice, I guess, around healthy workplaces. So, as I mentioned briefly, a workplace health needs assessment. This is possibly worth spending a bit of time on. I'm going to quickly skip through this, but we've got a really great resource on our website. The link is below there, because often you might think you know what some of the health or well-being issues are for your staff, but I guess until you really ask that question, allow them to ask and think that through and answer that, you can't really get a feel for what the core issues may be. And this assessment goes through a range of different topics and issues. I've just picked one, smoking, as an example. So it allows you to sort of drill into a few different questions to get a feel for whether a lot of your staff smoke, gives you an understanding about what are the issues that causes for the people and for the workplace in terms of productivity. You know, that they know that quitting services are effective, that people use them and that they're good. They believe that, you know, promoting stop smoking campaigns in the workplace is good for them and for their organisation, and that they want that information to local services to help them quit smoking. And then it gives you just a bit more narrative behind that. But I mean, this assessment goes across a range of different topics, and it's a really useful exercise to do with the people in your organisation, to get that baseline, really, to understand where they're up to and where are the key issues that you need to address. And from this as well, we have a fantastic website where you can access loads of really good high-level interventions that people could be signposted to, or they can go through themselves, or they can find local services to help them quit smoking, to be more active, maybe they want to lose some weight, whatever it may be. So please do check that out. And you're probably already familiar with this as a business in the community. They have lots of resources that are really, really good. They have some nice infographics behind them just to sort of set the scene and the scale of the issue, but also they go into some very practical toolkits and advice around a lot of these issues. So really, really good to go through some of these as well. So they can be a great bolt on to that assessment, I guess, at the end. That gives you a practical thing to help work through, I guess. An example being this one from around good mental health in the workplace. This is I guess a checkbox for you to be able to go through some of the key issues to make sure that you as an employer have the right things in place to be able to support your staff. And then another one I wanted to point briefly to, there is a program called Making Every Contact Count, or MEC as we refer to it for short. And our colleagues in Yorkshire and the Humber, Public Health England, developed a website. This is just a snapshot of the website, the link is at the bottom. And what this allows you to do is to drill down into a particular area to see what services are available. But not only that, it gives you some very quick kind of cue card advice to be able to help other people with particular issues. So you can very quickly, discuss the issue with them, say any kind of key issues around that, and then be able to signpost them to useful services. And the really nice thing about the website is it can list it by the place, so it can be like the local authority, or you can list it by the particular health issue. So you could look specifically at I don't know, stop smoking, for example, or you could look at an area in Lancashire and then find all the services that are available there. So it's a really nice resource. So please do check that out. It's great for signposting, but also for giving that very brief advice to be able to help people make those first couple of steps into whatever it is they want to tackle. I couldn't obviously do a presentation without talking about the C word. So here we are. Just wanted to make you aware of a fantastic set of webinars that have, unfortunately now they're all finished, but they were a fantastic series around helping workplaces to continue to support their staff around well-being through and beyond COVID. And it's gone through a range of really important topics, and we've got some great feedback. It was a joint effort between Society of Occupational Medicine and PHE. The website there has the webinars already recorded and a ton of resources there for you to look through. So do check that out as well. And whilst we're on worklessness, I thought it was also useful to shine a light on some of the programs that DWP are working on and we're supporting them with to help people get back into work. And as employers, we're always keen to help promote this and look for champions, I guess, to be able to help people back into work. So these are some of the big ones at the moment. The Kickstart scheme is to get people back from 16 to 24 back into work. The Work and Health program is a similar but much broader focus and has been running a long time. The Restart scheme, again, that works with anyone on universal credit claimants. But we also have a good website around apprenticeships for older people too. Often we find a lot of people are seeking to get back into work that are older, and they have some great skills and resources for us to that are attractive to employers as well. And finally, IPS Grow. IPS stands for Individualised Placement Support. They work with people recovering from serious mental health difficulties to find employment. And they offer a really intensive hand-holding service, essentially, that really helps them step by step to become ready for work, to get back into work, and to stay in work. And they work really closely with not only the person but also the employer too. So they're a fantastic program.
Excuse me.
As well, I just thought I'd throw all these resources down that are very useful. I'm not going to go through them all, but some fantastic stuff about health and well-being for you to have a look through. Some of our key programs, some of the NHS programs are definitely worth flicking through. I won't go into them in great detail. And at that point, I'm going to hand over to my colleague Annie. I've rattled through that, haven't I? Are we still on track? I think we're okay.
And Peter, you're doing the slides, aren't you?
I'm doing the slides.
Next slide, please.
I'm ready. I'm ready.
Okay. So, like I said, my name's Annie Murray, and I work with Peter in the Northwest Public Health Centre, and my sort of portfolio area is mental health and well-being, including suicide prevention. Do you want to next slide, please, Peter? It's all right. So I just wanted to. I think for me, what's really important when we're talking to people about mental health and we're thinking about mental health, that we actually have a common understanding of what we mean by mental health. So I've been around for, I don't know, around this field for kind of, I don't know, probably over 3 decades, and it's all been called kind of different things. And I think sometimes when I think about mental health, particularly within PHE, what we use is the World Health Organization's definition of mental health, which is a state of well-being, and it isn't about mental health. It's about actually all of us kind of meeting our true meeting our own potential. There's obviously in that definition, there's something about working productively and fruitfully, which is obviously what you want from your workforce, and to make a contribution to your community. And I think that obviously for those, I mean, I don't know who's on the call in terms of businesses, but clearly if somebody is working, they're more likely to spend money in their local bakery or their local shop. So actually, if you're a smaller business, people being employed will actually help your business. So that could be part of their contribution to keeping your local community or your local high street kind of going. And I think this, I really wanted to sort of, when we think about mental health also, what we generally think about is this idea of a dual continuum of mental health, and that actually there's a sort of continuum between poor mental health or mental ill health, and actually good mental well-being. And you could have a diagnosis of a mental health condition, but actually you might have really, really brilliant kind of mental well-being, because actually you've got all the things that we all need with or without a diagnosis to promote our well-being. And like Peter said, good work is one of them. Or you might actually have really poor mental well-being, and work might be contributing to that in some of the things that aren't there, what Peter was talking about control and kind of security, but you haven't got a diagnosis. So we're really, can you click it again, Peter? There's another little diagram. So I think for me, when we're thinking about mental health in the workplace, there are three kind of main groups of people. And there are those that are thriving in work, which will be most of us, most of the time. There are people that are struggling in work, and that might actually be a temporary thing. So it might be somebody has experienced a bereavement, which means they're anxious or they're depressed, or it might be that someone's got a long-term mental health condition that isn't managed very well. And then there's some people that actually will be off work, and they could be with or without a diagnosis, and they're ill, or they're struggling in some way. And I think what's really important as well is to think it's actually that we all, in the same way that our physical health fluctuates, for everybody, our mental health fluctuates as well, and it's never static, and it can kind of shift and change. And actually, workplaces can be somewhere that really nurtures good mental well-being if some of the programs that people do are really thinking about supporting people that are already thriving in work. So I think for me, any programs that anybody does has to think about, I think, this continuum and these three groups of individuals. Next slide, please. So people have talked, I think, Andy, you talked about the cost, and I know Peter's talked about the cost, but this cost is specifically around mental health problems at work. And I think for me, because it's quite a big figure, and I think for a company you might think, what does that actually mean for me? That's massive, and that won't just be what you cost. But I think what's really interesting about this slide is that it talks about the equivalent of like £1,300 for every worker in every UK business. So you could potentially work out for your business how much this potentially could cost you. And I think this cost is, it includes sickness absence, but it also includes presenteeism. So people will come into work when maybe they're not feeling their best and won't do their best work and won't be as productive. And obviously, what we also know as well is that there's some research which suggests that if somebody goes off sick with anxiety or depression, and they're off on long-term sick, and actually the workplace doesn't actually keep in contact with them, and the line managers don't contact them and just kind of check in and see how they are, that actually those people that don't have contact with the company are much more likely to just think, do you know what, I can't go back, I can't face going back. And obviously that in itself, if people leave and you've invested in time and you've trained people, that turnover and people leaving is actually a cost as well. And again, all these, I've actually put all the, so the slides have got the links to the resources if you're kind of interested in that. Next slide, Peter, please. So this slide is basically saying those people with a mental health condition are much more likely not to be in employment. You know, and this is something again that when you look at Lancashire, if you look at the stats for Lancashire, it's much higher than the England and the Northwest average. So it's really small. So the England and the Northwest average are similar, but actually Lancashire's much higher. And I think again that's just when you think about people so there'll be a lot of people with a lot of skills in this group of people. So again, those people that maybe have had issues around anxiety and depression, and then have thought they can't come back to their employer and that the work that they're doing, that obviously costs money. But again, it comes back to the point I was making earlier about people who are employed in your locality will help kind of other businesses through their spending power, if you like. Next slide, please. So I suppose when I've had conversations with public health teams in the past and they're looking at developing kind of workplace programs, I think there's a real pull towards working with the sort of the middle bit of that inverted triangle. So those people are struggling in the workplace because you want to keep people in work, and maybe some targeted support for those people that maybe are off work. But I think for me, what you really want is for those people who maybe are thriving. You want people to be resilient. I mean, Andy, you talked about a resilience workshop earlier. So obviously, when you're thinking about workplace approaches for mental health and well-being, I think it's really important to think of that holistic thing. So you're building a resilient workforce that actually, if something does happen and they're struggling a bit, they're still going to be as productive as they would be if they weren't struggling. So I think any program, and I think the stuff that Peter's talked about as well, those frameworks actually consider all these three elements of this inverted triangle. And I think also it's one size doesn't fit all. So Peter's talked about a whole load of frameworks. If you're a big organisation, then you might want a bigger approach. If you're a smaller organisation, it doesn't mean that you can't do something, I think, but it's still the same kind of layers of things that you need to think about, and you'll do it in very different ways because you've got different employees. And I think the other thing as well, I think what generally as well, what people also think about is employees, and I think we also need to think about senior leaders and managers in whatever kind of workplace programs that you have. So all the managers that are listening to this webinar, this is for you as well. It's not just for people that you line manage or supervise. Next slide, please. So in 2017, the government wanted a review of well-being in the workplace. And as part of that, obviously, the review, the Farmer Stevenson review, looked at sort of mental health and employees. And what it talked about was there are six core mental health standards, which kind of reflect the stuff that Peter was talking about. So there's nothing new here, and I think, but I think the key things really around having a mental health at work plan. So kind of understanding that previous slide with those three inverted triangle bits. What you're going to do for those people that are thriving, what you're going to do for those people that are struggling a bit, and what you're going to do for those people that are ill, and to really think about if you're going to develop a plan that to consider those three things, to have mental health awareness for all employees. And I think that isn't just for people who haven't got a mental health condition, because I think generally for some people, understanding some of the symptoms of some of the kind of mental health conditions, we don't, I might know what they are, and some people might think they're all right, but actually you might have somebody that isn't sleeping very well and thinks, oh, I'm just not sleeping very well, but actually that could be a sign of something else. So I think having a mental health awareness for everybody, I think, is quite important. And I think the mental health awareness is obviously not just about signs and symptoms of having a problem, but also about how we can build our own kind of mental health resilience, and look after ourselves in terms of our mental health. And the other one is around kind of encouraging open conversations around mental health. And again, I was reading an article, I can't remember where it was now, but it was, and it's about leading from the top. So the CEO of KPMG at one of this kind of big staff conferences talked about his depression and his anxiety, and the company then, people started to think about it, people were talking about it, and actually as part of that whole process, they then built a really fantastic program, a work-based program around mental health and well-being. And what they found is, like, a couple of years on, that didn't have as much kind of sickness absence, because people were able to kind of talk about what they felt like, and there was conversations, and they felt really supportive. So again, just leading from the top and kind of not being frightened to kind of say, actually, people shouldn't share things they don't want to share, but actually I think that's really important, not to be embarrassed about it. Because if somebody, one of the things I find is that, you know, if somebody had a diagnosis with cancer, people would happily talk about it. But people have a diagnosis of a mental health condition, and there's still a little bit of stigma, and there's still a little bit of shame for some people. And I think what the CEO of KPMG did was, like, just kind of knock that out of the water. Obviously, good working conditions.
Sorry to interrupt you mid-flow. I'm just conscious that Vicky has got a limited time frame.
Okay, all right. So this is the last slide.
I'm just saying that really segues really nicely to what Vicky's about to talk about.
Okay.
But that'd be great if we could hand it over to Vicky.
All right. Okay. So there's 2 more slides, but they're just resources, so people can have them and look at them. Sorry, I didn't realise I was taking up so much time.
Yeah, okay.
You can read it anyway. You can all read.